Hello, I wanted to provide a brief overview of the article from the Journal of Applied Behavior Analysis entitled The Assessment and Treatment of Problem Behavior Maintained by Escape from Attention and Access to Tangible Items. To put this article into context, it is a case that I worked on while I was at the Kennedy Krieger Institute, which is affiliated with Johns Hopkins University Hospital. At the Kennedy Krieger Institute, they provide services to individuals with severe behavior disorders, so things like self-injurious behavior, aggression, property destruction, and so forth. Most of the individuals served at the Kennedy Krieger Institute have some form of a developmental disability or genetic disorder, and as mentioned, some form of problem behavior. So individuals who are admitted there receive an assessment in the form of a functional analysis, and I'll go over that by way of the article, and interventions are designed based on the assessment results. So let's get into the article. So one of the things that this article talks about is a functional analysis. A functional analysis is basically an assessment approach to determine what's causing problem behavior in an individual, so something like aggression or property destruction or self-injury. And this form of assessment is different than most forms of psychological assessments in that we're actually going to expose the individual to certain environmental events to see how those events influence the problem behavior. Does it cause more problem behavior or no problem behavior, and so forth. And by exposing the individual to these environmental conditions and observing the problem behavior, we could determine the conditions under which problem behavior occurs most. So a functional analysis is a unique approach to assessment. Sometimes, however, the general assessment approach needs to be modified, and that's what this article is really focusing on, modifying those conditions that we expose the individual to. So in applied behavior analysis, we think of the causes of behavior or the variables that maintain behavior as being reinforcement contingencies, positive reinforcement and negative reinforcement. There are a couple variations thereof, but generally speaking, the assessment approach is looking for those sources of reinforcement that are maintaining problem behavior. So this article is focusing on negative reinforcement, and the types of negative reinforcement that have been shown to maintain some problem behavior for some individuals is escape or avoidance from demands. So if you consider a student in a classroom who acts out to get out of doing the work, that is a form of negative reinforcement. Their acting out behavior is maintained by escaping work. Another possible form of negative reinforcement is avoidance of social interaction. And this is a variation that has been seen in individuals with autism. Some individuals with autism tend to engage in problem behaviors to avoid social interaction. So the purpose of this article was to show the assessment and treatment of problem behavior, where the authors used a modified functional analysis to clarify the results from an inconclusive analysis. Then, based on the results of those assessments, they designed an intervention to decrease the problem behavior. And that intervention is referred to as non-contingent reinforcement, or NCR, plus functional communication training. And I'll talk about those when we get to that part of the article. So in any article, particularly those that involve human participants, you will see in the methods section, they describe some of the contextual pieces along with the participant. So the participant was a 6-year-old boy diagnosed with autism and a mild intellectual and developmental disability. The setting for the study and the clinical case was an inpatient unit on a hospital. The data that were collected during the study and during the assessment and treatment was the frequency of aggression and self-injurious behavior. Basically what that means is during observations, data collectors would record each time the participant engaged in aggressive behavior or self-injurious behaviors. You don't really need to worry about IOA. That's an inter-observer agreement, and essentially that is a requirement for published studies that somebody else has observed and collected data. So within the procedures, they describe the assessment. And as I mentioned in the introduction, the assessment that's used is a functional analysis. And the functional analysis methods that were used were first described by Owada et al. In 92 and 94. And as I mentioned, you're basically exposing the individual, or in this case, the participant, Preston, was exposed to conditions that simulated conditions in his natural environment, the home or school environment. And I'm not going to go into great detail about each of those, but there is an attention condition that simulates periods of low attention, and when problem behavior occurred, attention was provided. An escape or demand condition, in that condition, academic demands were presented, and if problem behavior occurred, Preston would receive a brief period of a break, and then demands would continue. And those conditions were compared to what we call a control. So in a control condition, Preston received continuous attention and no demands were placed any at his favorite activity. So in that condition, we should see no problem behavior. That assessment resulted in inconclusive results, and we'll go over the results separately. So therein, the authors conducted a modified functional analysis. In this new analysis, they included a new condition, tangible. So in that condition, toys are provided and removed, and contingent on problem behavior, the toys are provided back. The modified condition was the escape from play condition. So here, what we're doing is testing for the negative reinforcement contingency, but specifically in the form of social avoidance. So in this escape from play condition, the therapist provided attention to Preston, and if he engaged in problem behavior, the attention was terminated for 30 seconds, and then we'd resume that session again. So when you're writing about these assessments, it's perfectly okay just to simply say that the study included a functional analysis to determine the causes of the problem behavior. That first analysis produced inconclusive results, so they modified the analysis to include a new condition. For treatment, there were common treatments prescribed for the specific function that was identified, and the function that was identified, as stated, was negative reinforcement in the form of escape from social interaction. And we also identified a positive reinforcement function in the form of gaining access to toys. So Preston had limited communication, so what we did was we taught Preston to communicate. So we designed this intervention, and we taught him to say, "Play by myself," or "Toys, please." So essentially, if social attention was being provided and he didn't want social attention, instead of engaging in problem behavior, he would say, "Play by myself." And then we'd give him a brief break. Then we'd reintroduce social attention. If he said, "Play by myself," we'd give him a break. So these communication phrases were replacing the problematic behavior. In other conditions, if he requested toys, simple phrase, "Toys, please," we'd provide toys. Right? If he engaged in problem behavior, we would not provide toys. The non-contingent reinforcement just simply included sort of a regular schedule of positive reinforcement for appropriate behavior. So these are our results. Basically what this graph is showing is the target responses per minute across individual sessions. So on that x-axis at the bottom, the numbers 1 through 38 represent observations, so clinical sessions or therapeutic sessions. and each one represents a different condition. And the target responses per minute are 0 to 10 on the y-axis. So in this initial assessment, you could see the conditions that were compared included toy play, which should be a control, social attention, and the diamonds were demand. And you can see from these results, they weren't necessarily inconclusive, but he was engaging primarily in problem behavior in the toy play condition. And as a control, that should not have occurred. But what was observed is, again, each time the therapist interacted with Preston, he engaged in problem behavior. So we modified that condition. And in our second functional analysis, you could see in the escape from attention condition, problem behavior consistently occurred, about 2 per minute. Problem behavior also consistently occurred in the tangible condition. So that is, what these data show is that Preston was engaging in problem behavior to get access to toys in the tangible condition and to escape the interaction with the therapist in the escape from attention condition. And those results are pretty conclusive. So they're telling us that these are the conditions under which Preston had problem behavior. This slide shows the treatment analysis. So again, we're evaluating clinical treatment of non-contingent reinforcement and functional communication training. That is, we taught Preston to communicate instead of engaging in problem behavior. So in a treatment analysis, in behavior analysis, we first have to collect baseline data. That is, what does the problem behavior look like without any intervention? How often did it occur? And you could see that in baseline, in the escape from attention condition, problem behavior occurred about twice per minute. And in the tangible condition, the graph on the bottom, problem behavior also occurred, roughly around twice per minute, but as high as probably 3.5 responses per minute. Focusing on the top graph, you could see that when the treatment was introduced, problem behavior reduced to near zero levels, with rare exception. Also, communication increased. So once we taught Preston how to communicate that he needed a break, play by myself, that phrase started to occur quite frequently, and problem behavior was reduced to zero. In this bottom panel, we taught Preston to request toys by saying toys please. So you see again that problem behavior remained relatively low, problem behavior being denoted by the open circles, and communication was variable but relatively high. So this treatment was effective at reducing the problem behavior. So as a general discussion, when you're writing your summary, you want to mention obviously what the purpose of this study was, that it was the assessment and treatment of problem behavior for a 6-year-old boy with autism who engaged in aggression and self-injury. You want to talk about the fact that assessments were conducted. One was inconclusive, and the modified assessment showed that problem behavior was maintained by negative reinforcement as well as positive reinforcement in the form of access to toys. Then you should mention that a treatment was designed based on those assessment results that showed that by teaching Preston to communicate, the problem behavior was reduced. And I think that's basically it. If you consider the principles that we've covered thus far in the course that are exemplified by this study, I think both positive and negative reinforcement were exemplified. Positive reinforcement in that Preston's problem behavior was maintained by gaining access to preferred toys, and negative reinforcement in that Preston's problem behavior was also maintained by escaping social interaction. Okay, I hope that clarifies the article. If you have any other questions, you can email me.